Hi, and this is our presentation on Score One for Health, an interview with Dr. Ray Newman. This is a presentation for Healthcare 6350 Quality Improvement in Healthcare. It is being conducted by Group 3, which consists of Taylor Atkinson, Evan Chipley, Rachel Finnemore, Kevin Wu, and myself, Scott McMahon. So to start out, we're just going to give you a little bit of an overview of what is Score One. So we decided to go a little bit of a different direction on this than I think some of the other groups might have. Um, Score One is actually a not-for-profit program that's run through the Kansas City University of Medicine and Biosciences. Essentially, it exists to increase access to at-risk populations. So the goal is to provide general physicals that includes an actual blood pressure, height, weight, cranial nerve check, dental exam, all of those things to local elementary schools. And basically, this gives a lot of these kids that otherwise might not have access to any sort of healthcare a early glimpse at problems that they might not have been able to find otherwise. The checkups themselves are performed by us, the medical students, under the supervision of attending physicians and nurses that are there to monitor things and confirm any abnormal findings that we identify. The hierarchy of Score One, the true top of Score One is Dr. Darren DiAgostino, who is the executive dean and director of health affairs at KCU. While he is technically the one who oversees the program, he doesn't do anything with the day to day. All of the day to day is actually ran with the doctor that we conducted our interview with, Dr. Ray Newman. He is the chief medical officer, and he runs all of the day to day. And he also directly oversees all of the staff and all of the students. A lot of the other issues are dealt with by the director of Score One for Health, which is Annette Campbell, who is a nurse that works with Score One. She supervises all the nursing staff and also supervises nurses that we work with from allied health organizations who lend us nursing staff. Some information about the demographics. So, like I said, these are at risk students at local elementary schools in the Kansas City area, and it's actually very interesting the way they identify the demographics that they want to target. Specifically, they use statistics on which schools have the highest level of reduced cost and free lunches, and they try and go after these schools as potential partners to screen for health issues because you're automatically going to be doing screenings at schools that have a higher number of students with a low socioeconomic status. A little bit of information on some of the stakeholders. A lot of the stakeholders are donors or members of the KCU Alumni Foundation. These are people that are actually providing the funding to help Score One operate. Children and families in the school districts. So the actual students that we're conducting screenings on, and their families as well. Obviously, the KCU and Score One staff, school district personnel who they have to work with, community partners in the area who they work with to help provide access to resources outside of Score One, and like we said, nurses from allied health schools and within Score One as well.
I'm going to talk a little bit about quality management of Score One for Health. Dr. Newman and Annette Campbell are the ones that oversee the quality management of the program. And while we mentioned earlier that Dr. D'Agostino does technically oversee the entire program, he has very little involvement in the day-to-day operations. So Dr. Newman actually manages the medical students, the attending physicians, and even the fellows, basically anybody who's involved with KCU. And then Annette manages the full-time nursing staff, the part-time nursing staff, and the other allied health school professionals that we work with. Then that full-time nursing staff also oversees all the training sessions. And so every professional that is involved with Score One for Health will undergo a training session, and those full-time Score One nurses will oversee those nurses and professionals' work to ensure that it is being done accurately and consistently. All of the schools that are involved in Score One are checked in with on a regular basis, and feedback is gathered from children at the schools, the teachers at the schools, nurses and other health professionals, the attending physicians, and the medical students. And then all of that information and feedback is compiled for the stakeholders in order to provide the data that the program is actually benefiting children's health and the medical students' education.
Score One's quality metrics are measured in a little bit of an informal fashion, but one of the ways that they measure quality metrics the most is through the number of referrals and follow-ups that they get. So if a KCU medical student is seeing a student who they think needs to be seen by a medical professional very soon, some kind of emergency or something like that, you can give them a referral, and how many of these referrals that are given out and how many have follow-ups that are documented is one way that they kind of track the success of the program. I do think that they have, from what we could tell, a little bit of an issue with getting some of that information, but yeah, that's one of the biggest ways that they currently are measuring their quality. And they actually just hired a new community health care position to help them kind of keep track of this. So hopefully they will, find some other metrics to help measure their quality and get more consistent data back on the ones that they currently have in place. Dr. Newman also mentioned that they have data dumps, which is when the school kind of gives them all the information that they have collected on the students and their health, from like questionnaires to parents and maybe previous events like Score One. So this is how they get a lot of their information in the first place, and then they can kind of use some of that to turn into quality metrics. And this is done by Dr. Newman, again, the Chief Medical Officer, and Annette Campbell, the Director of Score One. So then how they move forward with making improvements based on these metrics. He did make a point to say, Dr. Newman, that they take concerns from every level. Sometimes, Dr. D'Agostino, the dean, or Dr. Newman himself or Annette can raise concerns that they have. They take comments from KCU medical students. This is probably done in the form of Open Door, which is a website that the school uses to collect comments, concerns, questions from the medical students that our student government and administration can address. And some concerns maybe even raised by the school, like the elementary schools that are involved, either from staff, teachers maybe have concerns about like time or something they have seen done, or the family members when the students go home and talk about their experience. Maybe even the students, I'm not sure how much data is collected from them, but if they had something to say, I'm sure it would be taken into consideration. And right now, due to how much Score One is in the process of growing and expanding, from what we could tell, a lot of the solutions that they have addressed so far involve hiring new staff members, like the community health director position that I mentioned in the previous slide. And I think that's just, a common feature that you'll see in a lot of growing businesses where as their clientele grows, as the demands grow, you need to hire new positions to be able to make improvements and measure how you're doing.
So talking about public reporting, the Score One program actually does this quite well. There is reporting on multiple levels at the school level. So a report is given to the school, and then another report is given to the school district, and then another report is given to the president of the school district, as well as another report is made for the community. However, Dr. Newman has mentioned that there hasn't been a report for the community in the past 5 years, and I can see why that would be, because that would be probably the hardest to gather all the data from the different school districts and all the schools and from all the principals, and then combine that and analyze that data. So it's probably the most difficult to get. There also has been difficult to add statistics about follow-up, and for example, for patients who have a vision problem and need to get glasses, there's a lack of data in whether the patients got the glasses. So therefore, patient outcome statistics for some things, especially follow-up, is a little bit lacking as well. And Dr. Newman has also talked about some challenges about the Score One program, and one of the largest one is just dedication to the program itself, because Dr. Newman has other responsibilities and he is a chief medical officer. However, there's no set dedicated time for Score One, and there also could be more support for the staff to focus in on and just focusing in and having more support to accomplish the responsibilities for Score One as well as better documentation of follow-up. As I said, it's much harder to follow up with a patient after they leave the program.
Now on to successes and challenges of quality management. The big quality management success within the last few years has been KCU developing its own iPad app for students and nurses and doctors to use while we're visiting these schools. This allowed for a lot greater use and a little bit more customization in terms of our charting. Before, it was just a paper and you would click abnormal or normal, and it would, you would just have to fill in the details of what was abnormal, whereas now the app can sort of suggest some things for students to look for that may be abnormal, provide check boxes instead of making everything just sort of a free fill in the blank. This has just also allowed us to better assess and analyze the number of kids we're seeing, what sort of conditions we're seeing, and present that in a more cohesive format rather than just going through paper charts and having the nurses after the fact have to enter everything online in their own free time. This is also really helpful in the cases where students are maybe misinputting some things. That definitely was something that occurred. We are given directions, but sometimes they're a little brief, and this way, when maybe there's been like a formatting issue, IT can go in there and maybe adjust it to what it should be much faster than the nurses could do just by filtering through everything on their own. The big challenge right now is extending that thoroughness of documentation to the follow-up process. That is one of I would say the greatest strength of the Score One program is the fact that it is aggressive in its follow-up. That's what makes the difference, is that we don't just go see these kids once. The nurses are calling the parents, calling teachers, making sure that kids get care after the fact. However, because this is kind of a highly tailored process, our charting hasn't quite caught up to it. And a lot of times, it doesn't look the same for different kids, and it's happening spur of the moment, maybe a phone call here, phone call there. And so in terms of following through from end to end, we still have a lot to improve on, because stakeholders would certainly like to see some improvement there so they can get an idea just of the care that these kids are getting down the line with the follow-up process. So that charting process certainly needs to be improved. In terms of transparency, Score One certainly could be doing better. Our stakeholders, whether it be donors in the community or our health allies or KCU alumni, would love to see some statistics and some data showing the positive effect that this program has on these kids from end to end. So this means from the moment we walk into the schools to the end of the last follow-up. Is this kid getting better care? Have their health problems been addressed? And unfortunately, as I mentioned in the last slide, the follow-up care especially is lacking in terms of documentation. And so it's difficult to compile these reports. Now, this isn't necessarily from a lack of wanting to do so on Score One's part, but at the moment, we're still a relatively new program, and so we have limited staff and budget. And sometimes compiling these reports is just, it's not in the budget. I mean, it's certainly more important to be calling these kids and following up and affecting the actual change, but certainly the next best step would be being able to show this. And I said it was just kind of a chicken and the egg situation where it's like we kind of need more budget to be able to do this reporting, but at the same time people are sort of wanting this reporting before they contribute donations more. And so it's definitely not for lack of trying, but at the moment, transparency and being able to showcase what we do for these kids to our stakeholders is definitely an area for improvement.